there's a very exciting technology called the eValve MitraClip, which is a percutaneous, meaning it goes through a small incision in the leg, up through the veins in your abdomen and thorax and into your heart. And it's a metal clip that repairs the mitral valve and prevents the leaking without an open surgical wound.
Yeah, so we're thrilled to be involved in a new trial that offers patients that are at high risk for surgery for aortic valve stenosis to receive a valve through a percutaneous approach, which basically means we can do it through a delivery through the skin rather than actually opening the chest to deliver the valve. So for patients that have aortic stenosis, have other medical problems, or are advanced in their age, this is an opportunity for them to get treatment that they otherwise might not have and allow them to enjoy the rest of their life with relatively good quality.
Let's talk about the real advantage of HeartFlow. How is it going to help us? How is it going to help the healthcare system in general? Well, first of all, it's going to help the patients, because now about 50% of patients who go to the cath lab don't have an intervention performed. Why? Because they really don't have critical disease. So if we could filter out that group of patients, how many angiograms? There are a couple of million angiograms a year performed. So if you could filter out those patients and not get them to cath lab, you're saving a significant amount for these patients for not having the procedure and the cost to the system.
Centers like ours have a highly specialized team set up to assess and treat patients with heart attacks very quickly to abort the heart attack in ideally less than 1 hour. A recent innovation launched just this year, known as LifeNet, will transmit the patient's EKG from the field to the Camino Hospital emergency room, which will be immediately read by an emergency physician, and if a serious heart attack is suspected, the cardiac team and interventional cardiologist will be paged to come to the hospital sometimes before the patient, saving precious time.
Historically, surgical ablation involved open chest, open sternotomy, cardiopulmonary bypass, big operation. These days we can do it with just a few little small port sites, about 1 centimeter, 3 on each side, and patient is still under general anesthesia, but patient has significantly less pain, recovers very quickly afterwards, and it has a higher success rate than the catheter ablations for AFib.
Personalized medicine, as far as it relates to cardiology, is most important in genetic diseases, and an example would be a long QT syndrome or hypertrophic cardiomyopathy. It would also be important in certain medications, in looking at how certain patients metabolize a medicine based on their genetic makeup.
So we really try to have a collaborative approach between the cardiologists and the surgeons for patients that present with atrial fibrillation. We really want to give them the best chance up front of a long-term cure for the problem, get them off the antiarrhythmic medicines and the anticoagulation.
We're happy to work with any physician, any discipline. We do this on a regular basis. We routinely train the doctors on the West Coast to come in and learn new techniques. So we're very used to dealing with patients locally and patients from afar who have these difficult to treat problems.
The beauty of our program is the fact that if a patient comes in, you have several sets of eyes looking at that patient, all coming together and saying, well, I think this would probably be the best option. And it's not based on, well, this is my patient or this is your patient. This is based on the patient's presentation and their clinical scenario, where we can say, you know what, this patient probably needs your input more than it needs my input, or this patient probably needs both of us to work together and collaborate on this. And we've done that and have been supported in doing that by the administration very well, and we've had fantastic outcomes, and again have been able to treat many patients that have been turned down for operations in the past, but unfortunately really need treatment, and we've been able to do that and been quite successful.